Today, we're going to talk specifically about heart health and what does that mean for our children and how does that change and morph over their lifespan and how they're growing. What should we be looking for? So, I am thrilled to introduce you to today's expert, Dr. Madeline Moss. Welcome, Dr. Moss.
Hi,
I am
how are you, Sierra?
I'm doing
Thank you.
well. I am really excited about this conversation, and I'm thrilled to tell our audience why you are today's expert. So, Dr. Moss is the medical director of pediatric cardiology at UHealth Jackson Children's Care, and she earned her medical degree from Georgetown University School of Medicine. And she also completed her residency at Baylor College of Medicine in pursuit of fellowship at the University of Miami Jackson Memorial Medical Center. So, I guess that's how we got you in Miami, right? You were all over, and we got you here in Miami. I love that.
UHealth.
She is board certified in pediatric cardiology and she specializes in fetal cardiology, pediatric and adult congenital heart disease, arrhythmias, cardiomyopathy. This is your wheelhouse.
Cardiomyopathy.
Cardiovascular disease, heart failure, sports cardiology. Sounds like the whole shebang. You really have a lot of expertise to offer us today. We're thrilled. She is fluent in English, Spanish, and French. We're going to stick to English today. And she
Please.
is dedicated to providing patient-centered care for children, for young adults with congenital or acquired heart conditions to help lead them to healthier, longer lives. So we are thrilled to have you and your expertise today. So thank you for joining us.
Thank you, Sierra, for having me.
Well, I love seeing where people are listening from. I see we've got Hialeah in the house. We got Miami. Listen to this, Kansas and Argentina. So
Oh, wow.
welcome. We went virtual back in 2020, and I'm so glad that we have because so many other people are able to join us. So also want to let you know, parentalguidance.org. File that away, audience, for all of our resources and archives there. There are dozens and dozens of episodes just like this, a dozen different topics in the archive. So that's at parentalguidance.org. All right, Dr. Moss, let's get started talking about heart health. And just generally, let's start and say, what are the earliest ways that we can begin promoting heart healthy habits in our children and in our families?
Well, of course, as parents, it begins with us. We have to be the role model. Little kids, as they learn from us, from the people that are taking care of them. We're the most important figures in their life. So if we're eating healthy, if we're enjoying physical activity and they see that, they're so likely to model themselves after us. And this is the most important time when they're small, you can make the biggest effect. And not only are we the role models, if they see us enjoying what we eat and enjoying being outdoors, they're going to want to do that also. But not only that, we are the gatekeepers in the early stages, and that's where people develop their habits. And if you expose your children to the right kind of foods early on, you can develop their palate, even develop their likes and dislikes, and make it fun for them. Expose them to a wide variety of healthy foods right off the bat, as soon as they're able to eat solids. And don't expose them to the things that you don't want them to develop cravings for down the road. There are even new studies that have come out about pregnant women and their diet during pregnancy. I thought this was fascinating, that even some of the unhealthy eating habits that mothers can have during pregnancy can actually uh, sort of modulate the genes of the child that affects their heart health even through
In
childhood
utero.
and beyond. So
Mhm.
it starts with us for sure. And, just restricting, offer them healthy foods from the beginning, and they'll enjoy it.
Mm, that's
And
awesome.
and later on in life, you find in these kind of kids that if they develop the taste for whole foods and nutritious foods, and that's what they're used to, we're creatures of habit. We feel comfortable with the things that we grew up with. They're much more likely as older children and adolescents, when they're in the environment where they choose for themselves, they're way much more likely to choose the healthy food over the unhealthy food, because we have that sense of comfort with our food and with the routines that we grew up with. So I think it really depends on the parents.
I love that. Dr. Moss, that's so good. And I love these parental guidance webinars because it really is equipping us with the information we need to take and do that hard work, that daily, we're with our children every single day and do the hard labor with them each day to see that, reap that reward over time. And I just want to make a plug in the archives. There's a whole episode, maybe 2 or 3 episodes in English and in Spanish about nutrition. So hearing that, I'm like, yes, okay, let's do it. And then I feel like, where do I start? So if you're listening and you feel that way, check out the archives. Start after this one with the episode on nutrition, and you're going to have all the things that you need to succeed in that way. So I love what you said about it starts with us and help establishing those healthy habits. Now let's talk about when you have a little tiny baby and you're newborn. How would you know? They're this little squishy, sweet thing. How do you know if your newborn has a heart problem?
Well, at first I want to say one of my passions is prenatal diagnosis.
Mm,
And that there are certain indications to even find out before the baby's born, which actually can be very, very helpful even uh, for prognosis and treatment. And your obstetrician should know what the indications are for a fetal echocardiogram or a consultation with a fetal cardiologist like myself. Some of the risk factors are if you have a family history of congenital heart disease, that means being born with a heart defect, not something that's acquired. So a primary family member, a first-degree family member, that's an indication to screen prenatally. And
okay.
if the mother herself has some other metabolic problems, such as a big one is diabetes, um, that can affect the fetal heart, the development of the fetal heart. And what we're seeing a lot more of these days as women are holding off on having children because of their careers and whatever, with assisted reproductive technology and IVF, we've found that there's also a bit higher risk of congenital heart defects if you conceive that way.
Wow.
So a fetal echo, it can be very, very helpful because we can outline what the defect is. We can make advice regarding the delivery process, what type of delivery, where the baby should be delivered, and then being available at the delivery should the baby need immediate intervention. And studies have shown that uh, if fetal echo diagnoses something important, even the surgical outcomes can be better because we never let that baby get sick. We know what to expect. We treat it
Wow.
right away. So we hand the surgeon a baby that has never had a major decompensation. Now,
Mhm.
if that doesn't happen, some of the things that you would look for in the neonate, that means the newborn in the
Right.
first month of life is what the
Okay.
neonate is.
Okay.
Um, the number one thing would for serious congenital heart disease, and it usually does present in the first month of life or even the first week of life, is cyanosis. That means a bluish color to the
Mm.
baby, a bluish tinge. And while all babies, I'm sure moms are out there saying, "Oh, my baby's hands
Oh,
and feet
yeah.
look blue." It happened to all 6 of mine. I said, "Wow, they
Right.
look a little blue." But when
Yeah.
it's the fingers and the toes, often that's normal, just a part of normal development in the immature baby. But when the lips and the tongue
Mm,
are bluish, that's a sign that you really need to get immediate intervention.
mm,
Then after that, other types of acyanotic heart disease, that means that the baby's not looking bluish,
okay.
those defects can develop a little farther
Okay.
in the first month or even the second month of life. And the reason for that, and sometimes pediatricians feel bad, they said, "Oh gosh, I didn't hear the heart murmur initially on the initial exam," but we should never be upset about that because sometimes it really just isn't there
Oh, wow.
because the
Okay.
adaptation of the baby's circulation postnatally sometimes takes weeks or even months to go back from fetal circulation to postnatal circulation, and then around a month or so if your baby starts to breathe fast, breathing too fast, or labored breathing. That's a sign that you need to investigate further. Feeding difficulties are a big one. Mothers know what's normal feeding for their baby. They start to see what looks normal for them. And if it seems down the road that your baby is now taking a longer time to drink the same amount of volume, or
Mm-hmm.
pausing to sort of catch their breath,
Mm.
or sweating too much during feeds, that can be a sign that
Oh,
there's something wrong with the heart. So
wow.
those are three of the big ones.
Oh, that's wow, it's fascinating, and you truly are an expert. So those are the signs to kind of look for the congenital heart defects in newborns, correct? When you talked about
And not gaining weight well. So
okay,
if
okay.
on follow-up with the pediatrician, they're not gaining well, often it's because they're burning excess calories because they breathe faster and harder, and sometimes their heart rate will be faster too, and all of that burns calories, and so their weight gain won't be as good also.
Okay, all right. Our audience is already jumping in, and I love it. So we've got a question that this listener has an 11-year-old, a 5-year-old, and a 1-year-old, and she says, "How can I help? These variety of ages stay heart healthy." So I love this. We are going to answer this question because we are going to work our way through the lifespan. So here we are talking about newborns. You mentioned heart murmur. Is it normal for a baby to have a heart murmur? Like, or
So
do they grow out of that, or is that a big red flag?
that's a great question. So don't panic if the pediatrician says, I heard a heart murmur. So, in the first few days of life, or even the first few weeks of life, as I said, the baby has to adjust to postnatal life.
Hmm.
There's a totally different circulation that counts on the placenta in the womb.
Right?
And there are several things that are several structures in the fetal heart that are unique to the fetus
Wow.
because of placental circulation. The baby's lungs are collapsed and filled with fluid. The mother's placenta is acting as the oxygenator. So there are two structures that remain open when the baby's in the womb, and then postnatally, as the lungs open up, these structures will close. So often, babies may have murmurs very frequently in the first few days of life, and often the pediatrician will hear it, but if it disappears, they become less concerned about that because it's a matter of the fetal circulation closing down. Um,
Our
but
bodies are amazing.
it is
So intentionally created.
miraculous,
It really,
miraculous to see it actually.
I
When I
can't.
see that fetal heart in utero, and it's just a completely different circulation, and then suddenly after birth, it it's totally different. It's two different circulations. It's just
Incredible.
nothing short of miraculous.
It is.
But but then there are many innocent murmurs in childhood. So about 30% of kids are going to have a heart murmur at some point in their life. Pediatrician gets a little more concerned when it's in the newborn, and they'll usually listen for a while. If it doesn't sound too harsh, they might wait for one visit. And then if you bring the baby back and they're still hearing it, usually that's going to prompt them, at least in the first month or so of life, to seek a pediatric cardiologist to try
Okay.
to make sure there isn't something wrong with the anatomy or the function of the baby's heart.
Okay.
But most murmurs will be innocent, and those can be related to things like fever,
Yeah.
because all a murmur is a sound. It's a sound. It's an extra sound that we're hearing. So and it's caused by turbulent or accelerated blood flow in the heart. So if you have a fever, your heart rate goes faster and it pumps harder. So the pediatrician might hear the murmur then with the fever, but you come back later and it's gone. Anemia, if you don't have enough red blood cells, that the blood will accelerate more and you can hear that sound. If you're have a hypermetabolic state from something like an overactive thyroid, that can
Mhm.
cause it. Or just plain, I don't like being in the doctor's office, I'm nervous.
Yeah.
Catecholamines, adrenaline. Well, so those
Okay.
are innocent murmurs, and it's nothing to worry about. And sometimes if the child's thin enough, uh, all babies and all human beings, our valves leak a little bit.
Okay.
And sometimes you can hear that actually much better in kids than adults because we have more tissue between the stethoscope and the heart.
All
So you
right.
shouldn't panic when you hear the word heart murmur.
Okay. And if you do have something, that's something they could grow out of. Yes or no?
Yes,
Yeah.
absolutely.
Good. That's great. Oh, that's good. Yeah, that word sounds scary. All right, so we talked about newborns, and now let's talk about toddlers. Are there common signs of heart issues in toddlers that we should watch for?
Toddlers, I will be honest, most of the time, major heart disease is going to present in younger than that.
Okay.
But there are certain things that we will start to notice in toddlers. If they happen to have a hole in the heart that is bigger than normal, all babies are born with a hole in the heart. If it's small, it's supposed to close in the first year or so of life. If it doesn't close, and up to 20% of the adult population may still have that little hole and they don't even know about it. As long as it's small, we don't care about that. But if it's a little bit bigger, you may not know about that until the heart starts to enlarge a little bit because too much blood flow is going to the lungs. And then maybe the mother might notice, especially if she has more than one child, oh, this
I
little
guess
one
out of breath
isn't,
faster than the other
yeah,
one.
he's not keeping up with the kids on the playground the same way.
Right.
Or it's breathes a little faster. If you think your child is not doing the activity that most kids would do at that age, then that's a sign.
Okay.
Uh,
All right. Well, tell me about, we're talking about, of course, heart health. And can you outgrow heart conditions with diet and exercise? Obviously, we know those things are important.
well, congenital heart disease, which is structural heart
Okay.
disease, we don't outgrow it unless a hole is small enough that it just closes by itself,
Okay.
or an artery that looks a little too small, it tends to grow with the patient and then they can outgrow it. But
Okay.
when you're talking about acquired heart disease, that is coronary artery disease, high blood pressure, uh, those things we can reverse them with diet and exercise, or
Mhm.
at least prevent them from happening altogether. There are studies in children, unfortunately, autopsy studies of kids that maybe passed for some other reason, that we can already see plaques or fatty streaks in larger blood vessels as early as age 10, and it correlates with elevation of cholesterol. So we know that heart disease that we see in our parents and our grandparents is really starting in childhood. So yes, if we alter our diet and exercise habits, we can both prevent and in some cases reverse those effects. A diet higher in plant-based foods, I mean, it doesn't have to be completely vegetarian. That's definitely been shown to result in a lower incidence of cardiovascular disease. And the other thing that I think parents can do at all ages of early childhood and toddlers as well is just regular checkups. The American Academy of Pediatrics will recommend that cholesterol be checked at least once during early childhood and then later during adolescence. But if there's a strong family history of cardiovascular disease in the parents or the grandparents, then they probably should check it earlier, maybe as early as age 3.
Hmm. Oh.
So, and annual checking of the blood pressure, because blood pressure is, as you know, they say in adults, the silent killer. And the longer you have high blood pressure, the higher the chance of developing more serious cardiovascular disease and the younger that you might develop it. So discovering high blood pressure early and intervening is really important. So those annual checkups are really, really important.
That's great. I feel like I say it every time, but stay up to date with your pediatrician visits because it's very important to have that graph of seeing where they're going. So, in talking about preschoolers across the development, if a preschooler maybe has a heart condition, maybe someone's listening has little people with heart conditions, but are there any specific activities that could be dangerous? And what if our children maybe who don't have a heart issue, but they're complaining about chest pain or shortness of breath during play?
It's a really good question because at, and actually children at that age, and we will say it even with my patients that I know have significant congenital heart disease, you really have to weigh the risks and benefits because exercise is really important. And it's even really important for kids with congenital heart disease. Staying active is really important.
Yeah.
So, but eh, I think that in smaller kids, they're going to restrict themselves. You usually don't have to restrict your toddler or your younger child.
Right,
They they're not like the older kids that they're embarrassed and they want to keep up with their buddies. And even if they feel like they can't do it, they might push themselves when they shouldn't.
right.
But little kids, they listen to their bodies more.
Yeah,
They mostly they'll limit themselves, and that's what I even tell my patients whose children have significant heart disease. Don't be overly cautious because they're going to limit their own activity. Of course, you want to also keep your kids well hydrated here in South Florida. It's really important to stay hydrated and not get overheated because that can put a stress on even normal hearts and can
yeah.
cause fainting in children.
Okay, yeah, so important as we come into this summer season, staying hydrated. I love that. Well, let's talk about, we're the example and we're modeling by making good choices and staying active, but also we can model by having these conversations with our children. So, how can we talk to our kids about heart health in an age appropriate way?
Well, it's a good question. I think being open and honest about kids' health issues is great to do it from the very beginning.
Mhm.
You can uh, you can even you don't want to frighten them, but you can let them know that the choices they make now will affect their ability to do the things that they love for the rest of their lives. And you might see an example of an elderly person that is not very mobile, or even a pet that is, hasn't been taken on walks enough and he's gaining weight and can hardly walk again. You can sort of relate it to that and make exercise fun.
Yeah.
And don't reward kids so much with food, or we should reward them more with outings or time together.
Mhm.
Uh,
I love
a
that. That's
kiss, not a
I feel
not
like
a
I need to ask the cardiologist this because I might be sharing false information with my own children. But somewhere I heard that like red foods are so good for your heart, like tomatoes and strawberries. I don't know. So whenever
No,
we
that
would
is true.
red, my kids are like, "This is good for my heart, mama." And I'm like, "Yes, it is. Is it? I hope it is." But just
No, no,
little
it's
things
true.
stick
Yes, the
with them,
berries, the fruits,
Okay.
yeah, colorful vegetables,
Mhm.
and fruits in general, they have a lot of antioxidants. And
Okay.
maybe taking the children with you shopping and show them the different kinds of fruits and the beautiful colors and help them to pick out something that they like.
Let them choose.
Um,
That's
or
good.
having them maybe plan a healthy meal with you, cook with you.
Mm.
Um, discuss with them what you're going to eat, and family meals are also important to make them fun and not scolding too much, or eating should be a fun time and something that we love for the rest of our lives
That's
because
right.
it really is a joy.
Yes, that's right. I love that.
And that's another thing. Happiness is
Yeah.
very good for your heart. There are
Good.
studies that show that positive attitude
That's good.
can in people that tend to be more positive, have more purpose in life, enjoy life, have sometimes 30% lower risk of cardiovascular disease in adulthood.
That's
There
significant.
are plenty of studies on that. And I notice in this stressful world that we live in, just having practiced now for more than 30 years, I'm starting to see different things in my office. Before it was more the real pathology, and now I see, not that it's not a real pathology, the
Right.
stress that
Oh,
children have these days.
wow.
Maybe don't put so many activities on them. Let them enjoy a little bit of playtime, because stress is hard on our cardiovascular system for many reasons. It elevates blood pressure. It 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 promotes obesity, because many people eat out of anxiety. I'm
Right, right.
guilty.
Right. I know.
Um,
Have that brownie if I'm having a sad day.
Seems to sometimes help, doesn't it?
Sometimes it feels like it does.
I wrote
We
a
could have a
note.
whole episode on that, I think, cardiology and cardiac
Mhm.
health and stress. I just think let's tuck that away because I definitely think that that would be a great episode for the future.
Yeah.
You mentioned, of course, visiting our pediatrician, having those benchmarks of blood pressure and checking for cholesterol. But are there any other ways you would say we should monitor our child's heart health as they grow older?
I think you about covered it. There are guidelines on this by the American Heart Association, and actually those are really good resources for anybody listening. The
Mm,
National Cholesterol Education Program, American Heart Association, American College of Cardiology, and very importantly, the American Academy of Pediatrics. So they're very much interested in heart health, because we now know that if we can get a handle on this, and in my practice's age group, we
yeah.
might put those adult cardiologists out of
Out
business.
of business.
I'm kidding. I'm married to an
Like,
adult
that's
cardiologist,
very,
but no, we can, and
yeah,
we want.
yeah, that's
It's
great.
really
That's great.
important. And so the pediatricians are really involved in this, and they know when to do the referral. I think if you have a family history of early heart attack or just hyperlipidemia, so
Mhm.
much of it is genetic. If you find out early enough, there are guidelines of when to treat. Of course, we always try in younger people, because we know that they may end up on being on medications for a long time. So
Right,
we try to do things without medications. And of course, that's diet and exercise. And it
right.
really does work. So,
Okay.
but if you do reach a level of cholesterol that is too high, there are medications that we would use as early as age 8, or if you
Wow.
have other metabolic problems, sometimes even children with diabetes, and that's something we haven't talked about yet. There
Right.
is a higher incidence of pre-diabetes or type 2 diabetes in young kids now, that before we were seeing mostly in people my age, but
Wow.
a lot of that is related to obesity and the type of the quality of foods that we're eating. And we
Mm,
Americans are top on the list for some of those bad foods. We have
that's
to
right.
think about whole foods. If you think about it, a nutritionist, and I'm not a nutritionist, but when we talk about a low-fat diet, it's going to mean 30% or less of your calories, of your daily calories in fat. And so how do you calculate that? Well, 1 gram of fat is about 10 calories, so you don't want to do more than 30%. But you can teach kids how to read labels, but guess what? If you buy Whole Foods, they don't come with
They don't
labels,
have
right?
labels. You don't have to
So you
worry.
can just eat
All
as
right.
much as you want.
Enjoy. I'm thinking of you as a mom of six, as a cardiologist married to a cardiologist. I'm like, I would love to have like be a fly on the wall at your dinner table because the discussion, but also like, okay, what are they eating? Because this is something obviously that you've prioritized. And so I love that. I love hearing that. And yeah, a
Well, we're
reminder.
all guilty. We're all
Oh,
guilty
for
of
sure.
cheating and
We all
other
enjoy
things. Every
treats.
now and then,
That's great. What about
me
family
too.
history? You mentioned a little bit about on the front end, and yeah, we would love to put the adult cardiologists out of business and tackle this when our kids are young. But a lot of people listening, myself included, I have a family history of heart disease, and how should I be nervous of how that's going to affect my child?
Yeah, I think great question, because so much of cardiovascular disease, both acquired means you develop it over time, and congenital, what I deal with, being
Right.
born with a heart defect does have a genetic component to it.
Right.
But I don't want people to panic over that
Mhm.
because our genes are what make up all of us, and we all have different ones and different ones we need to worry about. But knowing about it is beating it.
Yeah.
So the things that I would say, at least from a congenital standpoint, congenital heart disease does run in families.
Okay.
About
Right.
1% of the population is going to have a heart defect.
Oh,
That could be serious.
yeah.
If
Yeah.
you have one child that had a heart defect, then your risk goes up to
Mm.
about
The next.
4%.
Wow.
But if it's the mother or the father, particularly the mother, that themselves had the heart defect, it's a much higher risk, could be between 10 to 15%.
Oh, wow.
So that is really important. And those are the type of patients we'd say do screening prenatally. But
Hmm.
again, knowing about it is everything because most of the congenital lesions, uh, more than 99%, there is a good treatment for today. In fact, there are now more adults living with congenital heart disease than
Mm.
children. And that just speaks of the incredible advances we've made. So
Okay.
don't panic about these things. We just need to discover them.
Yeah.
And then there are other things that are really important to know about that do run in families. So if you have um, a relative that may have died suddenly at a young age, less than say 30,
Hmm.
that's an indication to be evaluated.
Okay.
If you have a family member that has aortic disease, vascular disease at a young age, or had a rupture of an aorta, uh, that's something that can be highly hereditary.
Okay.
Certain types of heart muscle disease are highly hereditary. And sometimes the patient or the child doesn't know that they have it until something
Mhm.
bad could happen. Like when we hear of young kids or passing out, or even worse on the football field, the
Right.
soccer
Right.
field,
Right.
the number one cause for that is heart muscle disease,
Wow.
and it's usually hereditary. That being said, uh, there's always the first person that gets the genetic mutation. So whenever this is, I guess, leading into something you were probably going to ask me anyways,
Yes.
that
Keep going.
when should you be worried about
That's right.
uh, chest pain or something like that? Well,
Yeah, or like our children on the sports field, like it's
yes,
safe
this
for kids with a congenital heart disease to play sports, or do we have to bubble
right.
wrap them for the rest of their life,
And,
like
and and this is really important. So in the older child who's starting to play more uh, aggressive sports or competitive sports, many schools now offer free, or hospitals offer free screening.
okay,
Holtz offers it, as I
that's
believe
great.
so.
Yeah, that's
Uh, EKG screening.
oh, well, okay.
That's it. That's not
Mhm.
a foolproof method, but it's better than nothing. So if you're
Yeah,
going to play competitive sports, I think at least a screening EKG is a good thing to do.
that's
And if
great.
you have a
Cool.
family history of heart muscle disease also,
Okay.
because sometimes the child won't have symptoms. And those are the things that are highly hereditary. Um,
Okay, and that's helpful. Yeah, we're not in the teen years yet, so I'm not even thinking that, but that's a good thing to put on the radar. If your kids are going to be, and there's so much sports things going on now, and you always hate hearing the headlines of things like that. So that's a good thing to tuck away. And for those of you that have teens that are listening, we've talked about newborns, we've talked about toddlers and elementary kind of age children growing up. Let's talk on about teens now. And then before we do, you mentioned a little bit this, but how obesity and poor diet does affect our hearts. We know that. How specifically is it affecting us? And then let's kind of segue into how we can help our teens really adopt healthy habits because now they're starting to really take ownership. They're out with their friends, eating that kind of thing.
Yeah, so obesity's it's really important. It's one of the major cardiovascular risk factors, and maybe it's even more important than we think because it is it causes other things to develop that are major cardiovascular risk factors, such as high blood pressure. And that's one of the things that I said, we can reverse uh, hypertension to some degree by losing weight. We can lower our cholesterol without medication by up to 20% by losing weight. Um, and obesity also sets us up for diabetes, which is
Mhm.
one of the most major risk factors for early morbidity and mortality in adults with heart disease, one of
Mhm.
the big causes. So it's really important to try to get a good BMI, and I've struggled with this my entire life. So
Mhm. Mhm.
um, I
Oh,
really sympathize with everybody who has
yeah.
that problem.
It
And
sounds like an easy fix, but we understand it's not. This is
very, very
lifestyle,
difficult.
a day by
And no
day.
matter what we want to say about some of the newer things that you hear about for obesity, all of them have limitations and all of them have side effects. So getting back to what we just started out with,
Mhm.
if we can try to do it when we're small and little
That's
and
right.
learn those healthy lifestyle, it does stay with you for life. And
Right.
no matter what you do, I know that, a lot of people are today taking medications for this, but it's only going to work as long as you take it, and there are side effects. But if you don't change your mindset and your lifestyle, uh, it's gonna recur.
Yeah,
But keep the fight going. That's
that's
what
right.
I've done my entire life because I
That's right.
fight this, obviously.
Yeah, no, same. No, that's such a good reminder. And even just as a parent, thinking in all really facets of parenting that it is so hard. Oh, it's so hard. But I think it's probably harder to course correct later than it is to just stay the course, like you're saying early on,
No,
and that all sorts of ways.
and you asked me other things in the adolescent area.
Right.
So
Uh-huh.
let's talk about smoking.
Mm.
Um,
Hmm.
okay, the
Yeah.
worst risk factor is
Yeah.
smoking for almost everything, for coronary disease, stroke, heart attack, hypertension, kidney disease. Smoking is a bad guy.
Hmm.
Really, really stress that, and try to let your teen be the one that is the leader in not smoking.
That's
Let
right.
them be the standout. And vaping also. Some kids will
Yeah.
say, okay, it's not as bad as smoking, but we don't totally know that yet. And we do know that it affects the vasculature for sure in a negative way and the lungs. So those are things that teens, you want to keep away from that.
Hmm.
And getting outdoors more. This is the time when maybe I think kids, both teens, there's high stress level, depression, and all of that. They may have less of it if we know that this is a really not a great thing for us. It's a good thing, but it's not a good thing.
Right.
Limiting screen time, having teens go out more together, doing things, maybe going to the gym together or taking walks together. Sometimes so many kids have the pedometer their Apple Watch,
Apple Watch. Yeah.
maybe doing a little competition together
Challenge.
with how many
Yeah.
steps did we do today? If you do
That's
between
great.
5 to 10,000 just
Yeah.
steps, uh, that's really gonna help.
That's
Uh,
great.
Socializing more than rather than just doing it on the phone, getting
Hmm.
out because that social interaction is important also for support and lowering stress levels. All of these things have secondary effects on cardiovascular fitness.
I love it. That happiness factor you're talking about.
A
Eating
hap
healthy, exercise,
happy
staying happy,
a
getting
happy heart
outside.
is a healthy heart.
I love that. And I love what you said about getting outside. I read a statistic recently that said even just 2 generations ago, kids were spending on average of 7 hours a day outside. And now the statistics show that has shifted to 7 minutes. I was shocked. Reading the statistic, I thought, get outside, kids. So I love that you're saying that. This is coming from our expert, from our cardiologist, our expert. So this is so incredibly helpful. I've got just a couple more questions for you, and I want to remind our audience if you have a specific question, get that in now, and I'm going to try to squeeze it in before our time is up. But thank you so much. This has been so helpful. And talking about teens, and you said, suggested getting the screening if they're playing sports. But would you say that that screening would be useful and necessary for any teen if you have a family history of heart disease?
Uh, I I think it's a very good idea, yes, to get a screening EKG because it just also what I told you, there are some acquired forms of heart disease that don't have anything to do with hereditary. In fact, another significant cause of morbidity and even mortality in young people during sports is myocarditis. And
Mm,
sometimes we could have a virus that we didn't know it attacked our heart, and then, um, you know,
yeah,
sometimes that can cause scarring in the heart and arrhythmias.
right.
Um, another big we didn't talk about this because this is another whole session is arrhythmias. Arrhythmias, certain types of arrhythmias. Arrhythmia means an irregular or too fast or too slow heartbeat, is on the list of causes for serious events in childhood, especially during sports. And there are many of those are hereditary also. So an
Mhm.
EKG can show us a lot. And so, yes, I think before when you're starting to get to that age where you're performing more competitive sports, and as I said, some kids they just want to be part of the crowd, so they're going to keep pushing themselves even when maybe they shouldn't.
Right,
Less
right.
concerning for the smaller
The
child.
little ones, yeah, that's right.
But, EKG screening's a really good thing to do, and then the pediatrician will know when, more advanced screening like echocardiography or exercise stress testing needs to be done.
Okay. Dr. Moss, I have so enjoyed our conversation. You are
Me too.
truly a treasure trove of heart health information. I am really thankful for your time today. I know you've stepped away from patients to be with us, and that means a lot. And I hope our audience was encouraged. And I want to say thank you to one of our audience members who asked that great question. I have an 11-year-old, a 5-year-old, and a 1-year-old. And you know what? She helped us sum up the whole thing. And I think that you said it best when we just set those good habits early and we keep modeling those and we keep walking that out with our children, and that's just going to really pay rich dividends in the long run. You mentioned some of these resources as well, so if y'all would like to screenshot that or take a picture with your phone, we'll leave it up there for a minute. These are great ways you can continue your education on these topics. We will have this recorded and we'll send it to your inbox, and it'll be in our archives at parentalguidance.org so you can share with a friend. I want to take just a minute and remind you about our upcoming episode. Our next one will be March 20th at noon again, and I'm excited. This will be one in Spanish. So I will not be leading this one for you. You will have someone very much more equipped. But the topic is autism and neurodiversity. We did this episode in English, so it is in the archives. So you can get a jump start on it there. But specifically, we're going to do this episode in Spanish on Thursday, March the 20th. So we know that no two minds are exactly alike, and neurodiversity is a term used to describe the range in which individuals perceive and respond to the world, everything from autism to ADHD to learning disorders. So tune in and learn the conditions and diagnoses that fall under the term neurodiversity and the signs that a child is neurodivergent, and most importantly, how you as family and caregivers can better support neurodivergent kids. So that's going to be an awesome episode in Espanol, Thursday, March 20th at 12 p.m. And again, as a reminder, all the recordings of these episodes can be found at parentalguidance.org. And we're just so glad that you all joined us today. And Dr. Moss, thank you so much. I love seeing someone said, thank you so much. You're a gem and a wealth of knowledge. We're blessed and grateful to have you. Thank you, UHealth
Thank you
Jackson.
so much. I really enjoyed it. Remember, the heart is the source throughout time, through poets, philosophers, theologians of love, of passion, of happiness. So take care of it.
That is
Happy Heart Month